80% of people do not know that there is a link between your oral health and any chronic disease that you have. So for example, if you have diabetes, if you have poor teeth and poor oral health, it actually can elevate your blood sugar levels. So what we love to do is actually connect with community and actually deliver oral health education in a different way. I'm Carol Tran. I'm an oral health therapist based in Brisbane, Queensland, and I am currently the scientific chair for the Oral Health Association for our next Congress on the Gold Coast. I've previously been the president of the Dental Hygienists Association, our peak body for all dental hygienists, therapists and oral health therapists, and I've been a volunteer with that association for about 20 years now. And currently I am also the director, one of the co-directors of the Oral Health Home, which actually services oral health through a social setting for people that miss out on routine dental care. One of the biggest turning points was actually becoming a volunteer with the Dental Hygienists Association of Australia, also known as OHAA, now Oral Health Association of Australia. And what I started with there was being a volunteer within a state-based committee and then working up through the hierarchy to become the president of the association. So through that mentorship, the friendship and the guidance with that, I became the president, and that has actually opened a lot of doors for my career, both being an educator, a researcher, a PhD student, and now a graduate of a PhD student, now to running my own business. So I think that the starting point of being a volunteer within an association actually helps you create that opportunity to become a better version of yourself through mentoring, guidance, and also helping the association and profession to help get you to your real potential and your open potential to now becoming where I am as a director of my own business. So one of the biggest turning points within our profession and what we've done with the Professional Association was actually getting provider numbers for oral health therapists, and dental hygienists. And that has enabled us to become self-employed and actually bill directly to Medicare and private health insurers. So we are now truly independent practitioners that can practice in almost any setting, and including the dental setting and the dental clinic, and also outside of the dental clinic in community centres, in allied health clinics, in schools, without the supervision of a dentist. So that was a momentous occasion for our professional association where we actually lobbied the federal government to allow us to access provider numbers so we can actually truly become independent billing practitioners, just like any other allied health professional like an OT, a speech pathologist or physio. One of the biggest initiatives with our association is actually to promote our profession to work more actively in aged care, because we know at least 30% of the residents have malnutrition, and that malnutrition is actually linked to poor oral health as well. So, and 80% of residents actually do not have access to good oral health services because of financial aspects or through lack of professionals in there. So what our profession is doing is actually actively engaging with aged care, both the sector and our profession in there. And so one of the initiatives at the Oral Health Home is that we're going to walk the talk and actually become a part of an integrated oral health setting in aged care, where we're just like any other allied health professional. So think of us as the OT for the mouth. We're actually going to look after people's oral health through our professional lens and support the aged care sector to look after their residents and their oral health long term as well. We went up to Mackay with 100-bed residents where we actually delivered an oral health program that was much more social than actually a clinical setting instead. So for example, what we did was we actually integrated oral health messages into bingo and dental alphabet search as a fun way to engage the residents to talk about why they need their mouth, why they need their teeth, and why keeping teeth longer in their mouth is actually good for them and good for their nutrition as well. So through that, we actually ended up seeing about 50 residents where we did oral health checks and integrated fun education to make sure that we sell and promote good oral health messages so throughout their residency in that setting that they have good oral health for the rest of their life. One of the other things that we're actually doing recently is also running our first inaugural oral health conference on the Gold Coast with the Oral Health Association of Australia. So currently as a scientific chair, we are hoping to have about 600 people there across Australia, where we're going to be delivering true oral health education through our sector, and 50% of that is actually going to be delivered for oral health therapists, with oral health therapists speaking at the conference as well, which we have deliberately set as a target to make sure that our profession is speaking on behalf of our profession. One of the biggest trends that we see in our sector is the connection between chronic disease and oral health, and trying to get that conversation going overall. One of the biggest problems within our sector is that we are treatment-based. So for example, when you go to the dentist, is that you will actually get billed according to what treatment you've had. Currently, if you look at other sectors such as allied health, is that they bill usually via time rather than treatment outcome. So ideally overall in our sector, we'd like to actually encourage practitioners to actually look at a different lens and look at it through how much time I spent with this patient rather than how much treatment we've actually rendered as well. Another trend that we see in the sector is the link between chronic disease and ageing as well. So for example, we know for a very well fact that Australia's population is ageing. And as we also age, we tend to get more chronic diseases. And what isn't spoken about within our profession is how chronic disease is linked to ageing as well. So what we want to do is actually promote oral health, good oral health, as a part of healthy ageing. One of the other things that we do see in our sector is that as people age, they keep their teeth for longer. And as a part of our past is that we used to pull out teeth, extract teeth a lot, but now we're actually doing a lot more intervention such as implants, late stage orthodontics, and crowns as well. So what we want to do is actually promote the longevity of this treatment, and to make sure that this treatment stays with that patient long term by long-term maintenance and long-term good oral health as well. Connecting with the community and really doing grassroots work with both our profession and also the general public as well. Because what we do know from the statistic is that 80% of people do not know that there is a link between your oral health and any chronic disease that you have. So for example, if you have diabetes, if you have poor teeth and poor oral health, it actually can elevate your blood sugar levels. So what we love to do is actually connect with community and actually deliver oral health education in a different way through a community fund-based setting rather than through a sterile clinical setting. One of the earliest things you can do is to become a volunteer with your local dental clinic. Have an observation to see if this sector is for you, because it's incredibly fast-paced. There's lots of things happening, there's lots of noises, lots of interaction with patients, as well as the good old stuff like blood and guts and drilling that we do routinely as a part of dental treatment. And if that really truly ignites your passion, then becoming an oral health therapist and focusing on prevention as well as treatment and intervention could be for you. I'm currently 30 weeks pregnant with a baby girl, and I'm also a mum to a 2-year-old toddler, so that keeps me busy, very, very busy outside of work as well. So sometimes I feel like I'm in survival mode most of the time. But however, what I do like to do is head out to the coffee shop with my family and hang out there on the weekends as well.